pains me to once again ask the government about their commitment to health funding in my home province of Saskatchewan. 5 months ago on World AIDS Day, I asked the government if they would declare a public health state of emergency in Saskatchewan, as our doctors have been calling for over a year. Saskatchewan has the highest rates of HIV in Canada, Mr. Speaker, and 79% of those newly diagnosed are Indigenous people. Instead of heeding the calls for action, the federal government has instead cut funding for some of the organizations who are doing the important work of education and prevention, not just in cities like Saskatoon, but also in northern communities. As the media has reported, 2 Saskatchewan organizations have been left in the dark about why their federal funding was cut for AIDS and HIV outreach work. AIDS Saskatoon provided services to central and northern Saskatchewan, and together these 2 organizations provided services to a significant percentage of Saskatchewan. AIDS Saskatoon and All Nations Hope in Regina have had a combined total of $643,000 of federal funding cuts as of March 31st, and they're not really sure why. The government has not bothered to explain why they cut funding to 1/3 of all AIDS organizations. Given the growing numbers of HIV infections in Saskatchewan, these cuts are short-sighted and counterproductive. All Nations Hope had $350,000 cut in federal funding, while AIDS Saskatoon had $293,000 cut in funding. The AIDS Saskatoon affiliated office has been in La Ronge for 5 years, and its executive director, Jason Mercady, said it was heartbreaking to learn the federal funding would be pulled. We've been pretty choked. We won't be able to continue some of those activities, he said. This is part of a wider series of cuts to HIV organizations across Canada. 33% of all AIDS service organizations across Canada have lost their federal funding. According to the information released from the Government of Saskatchewan, the province's HIV rates of those newly diagnosed with HIV in 2016, 14.5 per 100,000 people, is 2 times higher than the national average. There were also 170 new cases in 2016, with 10 of those people living in the Churchill River Health Region, which included La Ronge. We're in the middle of an HIV epidemic, Mercady has said. As the federal government develops an updated national framework to guide Canada's response to HIV and other sexually transmitted bloodborne infections, one key thing is missing: a commitment to an adequately funded Made in Canada strategy. In fact, so far there has been no commitment even to simply reverse the chronic underfunding of the HIV response in Canada, now entering its 15th year. The funding erosion continues even as Canada's made international commitments to HIV treatment and prevention efforts with a view to achieving the global goal of ending AIDS in 2030. Canada's HIV response has clear gaps that need to be addressed urgently. Lives and public health are at risk. It's time for the federal government to restore the diverted and lapsed resources that are so desperately needed. HIV is not over, especially in Saskatchewan. How can this government cut funding for such important work in the face of a worsening epidemic?
The Honourable Parliamentary Secretary to the Minister of Indigenous Services.
Mr. Speaker, I'd like to acknowledge that we are gathered on the traditional lands of the Algonquin people. As the Prime Minister has said, there is no relationship more important to Canada than the relationship with Indigenous people. Our government is deeply committed to addressing the HIV, AIDS, and hepatitis C in Canada, including First Nation communities in Saskatchewan. Budget 2017 included initial investments of $37.5 million over 5 years to support the prevention and control of HIV and hepatitis C among First Nation and Inuit communities. Our government is also investing an additional $3.35 million in 2017-18 directly supporting First Nation communities in Saskatchewan. Further to this, our government has been working closely with First Nation partners, communities, and leadership in support of implementing Know Your Status initiatives within Saskatchewan. Know Your Status is a community-developed, client-based approach bringing sexually transmitted bloodborne infection-related services to locations that are best for the client. The Know Your Status model employs a multidisciplinary, multi-sectoral, and cross-jurisdictional approach, making it easier for clients to receive the support they need. Mr. Speaker, I'm proud to say that by 2021, our government will have nearly doubled the investment in Know Your Status to support the health of First Nation communities in Saskatchewan. In Saskatchewan, there are currently 23 local testing sites, 19 harm reduction sites, and 13 mobilized specialized community health, nursing, and outreach services. Measurable indicators have been set to ensure support of existing fully implemented programs, completing the development of partially implemented programs, and supporting community readiness. In 2016, the number of HIV tests in Saskatchewan increased by 11% amongst First Nations, and the number of harm reduction sites increased by 27%. Our government strongly believes that Indigenous families should have seamless access to health services provided by both the federal and provincial government to make sure nobody slips through the cracks. To achieve this, the Non-Insured Health Benefit Program provides First Nation and Inuit with medical transportation to access medically necessary health services that are not available locally. Once a patient reaches a provincially run facility, interfacility transfers that are necessary to the patient care is paid for by most provinces. The closure of the Saskatchewan Transportation Company falls within provincial jurisdiction. The department is aware of the challenges with access to transportation in some areas of the province as a result of this closure. Department officials have worked with new transportation vendors in some areas to secure provider arrangements. Funding has been provided to some communities to purchase and operate vans that are designated for medical travel. Thank you, Mr. Speaker.
Member for Saskatoon West.
I want to thank the honourable member for his response, but I do want to ask the colleague to hold his government to account. It really is unconscionable, given the statistics, to remove a third of the funding for these programs without any explanation, without any replacement in place. In face of the undeniable evidence that HIV rates are rising in Saskatchewan, we should be investing more, not just sort of moving it around the province. This government decided to cut funding to some of the most effective outreach and prevention programs that existed in the province. I believe the minister needs to answer for that, and so far we haven't received a word of explanation. And really, to add insult to injury, this government really has done nothing to mitigate the devastating impact of the provincial government's move to sell off STC. On January 3rd, the Honourable Minister of Innovation promised to work with me and my office to address this issue in a meaningful way. I have not heard a word since. How much longer do the people of Saskatchewan have to wait for this government to act?
Honorable député, l'honorable.
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. Mr. Speaker, our government continues to provide medical transportation for First Nations regardless of where they live through the Non-Insured Health Benefits Program. I'd like to stress the importance of the efforts of First Nations in Saskatchewan in the development of the successful Know Your Status model of health service delivery. The core components of Know Your Status are testing, specialized nursing, outreach, harm reduction, and prevention. The complementary components include mental health and addiction services, primary care and lab services, and linking with infectious disease specialists. Mr. Speaker, I'm pleased to share that because of our government's collaboration with First Nation partners, there is rising evidence of Saskatchewan First Nation communities achieving tremendous progress and even exceeding the UN AIDS targets that by 2020, 90% of all people living with HIV will know their HIV status, that 90% of all people diagnosed with HIV infection will receive sustained antiretroviral therapy, and that 90% of all people receiving antiretroviral
L'honorable député.